Hello everyone, welcome to Assist Biology. In this video, we'll discuss about sexually transmitted diseases, that is STDs and infertility. And this is the third part from the chapter Reproductive Health. Before starting this video, let me introduce myself. I am Ashish Kumar Das, a student of MSc Animal Biology, University of Hyderabad. And if you are new to this channel, please subscribe the channel and press the bell icon for getting more updates. If you have not seen the first two part of the video, that is first part and second part, I will mention the link in the description box so that you can watch the video. Now let's get started. So first of all, what we will learn today? We will see what are sexually transmitted diseases, that is shortly called as STDs. We will see what are the symptoms of STDs, then how the spreading of STDs can be prevented, that is how that a human being can be that is saved from the STDs, then what are the various techniques that are used to treat infertility, and we will also see each assisted reproductive technology, that is ARTs, is the only solution to infertility or something else is there, and we will also see many more things. Now, sexually transmitted diseases. First of all, we will define what are sexually transmitted diseases. So these are the communicable infection. So these are communicable infection, that is they can be spread from one person to another, and they are transmitted by sexual intercourse or genital contact. So they are the communicable diseases, that is they can easily spread from one person to another, and they are transmitted by sexual intercourse and genital contact. What are the example? The example are syphilis, gonorrhea, chlamydiasis. These are the most common example of the STDs. Then what are the general symptoms? The symptoms are itching, that is the affected area will itch. Then fluid discharge, that is the mucus from the affected organ or parts. Then slightly pain, it will cause us pain, and the swelling of the area will be, that is inflammation is easily observed. So here you can see these are the symptoms. I have put this diagram to show you the symptoms. So here you can see these two are for that is your oral STDs. So here you will see the affected part of the tongue, and here you can see the mouth portion. So these are the oral STDs, and here you can see the swellings. Here you can see these are the blisters like appearance, and this is a HPV virus. So we will see some example of common sexually transmitted diseases. So first of all, syphilis. So syphilis is caused by Treponema pallidum, and this is a bacteria. So you have to remember the name and you have to remember the category, that is here it is a bacteria. So sometime questions come in exam, then which of the following is a bacterial STD, so you have to pick up the correct option. Now that's after syphilis, gonorrhea is caused by Neisseria gonorrhoeae. So here the spelling will be GONORRHOEAE. So I missed a E here, so HOEAE, it would be HOEAE. So this is also a bacterial STDs. Then the chlamydiasis is caused by Chlamydia trachomatis. This is also a bacterial disease, that is STD. So syphilis, gonorrhea, chlamydiasis, all of these are bacterial sexually transmitted diseases, and you have to remember the causative agent, that is the Treponema pallidum, Neisseria gonorrhoeae, and the Chlamydia trachomatis. Now trichomoniasis. So trichomoniasis is caused by Trichomonas vaginalis, and this is a protozoa. So this is the example of protozoan STDs. Then comes the AIDS, that is acquired immunodeficiency syndrome. All of you might be knowing this. So this is caused by HIV, that is human immunodeficiency virus. So this is a viral STDs. Then come the hepatitis B. This is a sexually transmitted disease caused by the hepatitis virus. There are several hepatitis virus A, B, C, D, E, and among them hepatitis B is sexually transmitted. And the genital herpes is caused by herpes simplex virus and human papilloma virus. So these three diseases, that is your AIDS, hepatitis B, and the genital herpes, are the viral STDs. So they are the sexually transmitted diseases that are caused by the virus. Now the three viral infections, that is AIDS, as I have told, genital herpes, and the hepatitis B, cannot be cured. So these are the diseases which cannot be cured. So what is the option here? The only option to save the humankind from this is the prevention. So here the prevention is the only cure. In most of the cases we have seen prevention is better than cure, but in case of AIDS, in case of genital herpes, and in case of hepatitis B, the prevention is the only cure. That is, once a person is affected, they cannot be cured for lifetime. So prevention is the only cure. Then others are curable STDs, that is the bacterial STDs, and that the protozoan Trichomonas vaginalis. All these STDs are curable STDs. After infection, a person can be cured with proper care and medicine. Then infected person doesn't seek the medical help. That is, if a person is affected with the STDs, they usually do not seek the medical help due to two reasons. So what are the two reasons? First of all, the absence or less significant symptom in the early stages. That is, when a person is newly affected with the disease, that is the early stages of infection, what happens, there are, that is, absence of symptom is there, or the symptoms are very weak, or you can say very feeble symptom are there. So the person will not be distinguished to, that is, the affected person can distinguish whether he is affected or he is normal. Then social stigma attached to STD. So in our society, STDs are seen as a, that is a, like disrespectful or like miserable conditions. So social stigma is associated, and people often ignore these diseases due to the social, that is social prejudice, or you can say social myths associated with the STDs. Now prevention of STD. So how prevention of STD you can do? So these infections are reported to be high in the 15 to 24 years. So that is, you can say the adolescent and the, that is adolescence period, mainly after adolescence to up to youth period, in between the adolescence and youth period. So as this to this age group, most of the students belong, and it can be prevented and avoided by the following practices. That is avoiding sex with the unknown and multiple partner. So sex must be avoided with the unknown and multiple partners. That is use of condoms during every quarter, so this must be followed. Then seeking medical help in case of doubt and get completely cured. So if a person is thinking that he or she might be affected, she or he must take a medical help to get, that is to get medical treatment and that doctor's consultation, and this will surely help to get cure early. Or if you are diagnosing the disease early, then most of chance that you will be easily cured. Now infertility. So first of all, we will see what is infertility. So infertility is a inability, that is the lack of ability or lack of capacity, you can say, of a couple to produce children. That is, that in spite of the unprotected sexual intercourse, although sexual intercourse is there, no children are being produced. So this is a inability or lack of ability of the parents to have couples, parents to have children. So what are the reasons? You will see, these are the reason: physical reason, that may be the physical deformity of the genitalia, or the that is testis in male and the ovary in female. Then you can see the external genitalia can be affected, or the primary sex organ, that is testis and ovary, can be also affected. Then the congenital diseases, that is some disease may be present from the birth and they will interfere with the, that is the normal production of children. Then use of certain drugs, some drugs also affect the, that is the fertilizing ability, or they will cause a sterilization. Then immunological reaction, various immunological reaction, for example, some drugs are having side effect and it will causes, that is your infertility. Or even psychological imbalance also can leads to infertility in most of the cases. So all of these things, that is physical, congenital, use of drugs, immunological reaction, psychological imbalance in mind, all of these things are responsible for the, that is your infertility. So specialized health care units, so governments and private authorities like NGO have set up specialized healthcare units only for the infertile couples, and these are called as infertility clinics. So infertility clinics will diagnose the problem and give corrective treatment. That will, after the diagnosis, that is they will find out the cause, what is the cause associated with the, that is the infertility the couples are showing, and they will identify the cause, and after identifying they will give corrective treatment for many of these problems. So after giving corrective treatments, then the couples may produce normal children as like normal couple. Then when the corrective treatments are not available, that is if they are not able to correct that infertility issue, what happens, there are specialized techniques called as assisted reproductive technologies. So shortly they are called as ARTs, that is ARTs. So they are assisted reproductive technology to help the couples to have children. So here you can see, if the corrective measures is not sufficient, or that is the infertility clinic will not be able to provide that the cure for the infertility. So there are various techniques called as assisted reproductive technology to help the couples to have children. We will see this in detail. So assisted reproductive technology, so as the name suggests, assisted reproductive technology, so these will assist the parents to produce normal child. So they will assist the parents to produce the normal child and provide assistance to the infertile couples. There are various kind of ARTs, that is assisted reproductive technology. These are the test tube baby program, gamete intra-fallopian transfer, that is shortly called a GIFT. Sometime in exam they ask the expanded form of the abbreviation, so you have to remember the abbreviation, so like GIFT, ZIFT, ICSI, AI, etc. Then gamete intra-fallopian transfer, then come the zygote intra-fallopian transfer, ZIFT, intracytoplasmic sperm injection, ICSI, and artificial insemination. We will see this in detail. So these are the assisted reproductive technology, and they will assist the infertile couple to produce children. So test tube baby method. So what happens in test tube baby method, you will see ova is collected from wife or donor female. So ova is collected from wife or donor female, and the sperm from the husband or donor male are allowed to fuse under simulated condition. Stimulated condition or simulated condition means the condition that are that is equivalent to our body. So in our body, the fertilization takes place in the ampullar ischemic junction. So suitable condition is provided such that the gametes can fuse, and that is they will be fused in the laboratory, and this is called as in vitro fertilization, so IVF. So why this is called IVF? Inside the body it is called in vivo, that is in vivo fertilization, and outside the body it is called as in vitro, that is the in vitro means outside the body, cell free conditions. Then one question mostly you will see in quiz also, so general knowledge, this is a kind of general knowledge you can say. So Louise Brown is the first test tube baby. Here you can see the picture of Louise Brown. She is Louise Brown, and she is the first test tube baby born on 25th July 1978. So here you can see her mother, her father, and the child itself. So Louise Brown is the first test tube baby born on 25th July 1978. Now come to that other, that is after the IVF what happens. So the zygote and early embryo, that is after the fusion between the male gamete and female gamete, the zygote or the early embryo, because after the fusion zygote will be formed. Zygote also can be called as early embryo. So after that is the zygote or early embryo formation, they are transferred to uterus or transferred to fallopian tube. So whether they will be transferred to fallopian tube or whether they will be transferred to uterus, that will depend upon the number of cells, or you can say number of blastomeres present in the, that is the embryo or zygote. So for further development, so this is called as embryo transfer, because here you are transferring the embryo to specific location. So this is called as embryo transfer, and this can be done in two ways. First way, zygote or embryo up to 8 blastomere transferred into fallopian tube. So up to 8 blastomere they will be transferred into the fallopian tube, because in the fallopian tube after the 8 blastomere they will move towards the uterus. So up to 8 blastomere they are transferred to fallopian tube, and that's why this is called as ZIFT, zygote intra-fallopian transfer. And more than 8 blastomeres, after more than 8 blastomeres, that is embryo with more than 8 blastomere are transplanted into the uterus, and this is called as intrauterine transfer. So as you know, the fertilization is taking place in the ampullar ischemic junction. After that they will move, and what happens, so more than 8 blastomere they will be transplanted in the uterus, and this process is called as intrauterine transfer, because you are transferring the embryo into the uterus. Now gamete intrafallopian transfer. So gamete intrafallopian transfer means transfer of ovum collected from a donor female into another female. So here donor female will donate the, that is gametes, and the gametes will be transferred to another female who can't produce ova. So this is important. The female who can't produce ova but can provide suitable condition for fertilization and further development of the fetus up to parturition. So what happens, if a woman is not able to produce ova, but she can provide suitable condition for the development of the zygote, or you can say embryo or fetus up to parturition, here we can go for GIFT, that is your gamete intrafallopian transfer. And here what happens, the ova is collected. So here you can see the ova is provided from outside. GIFT catheter introducer is there. This is the tube you can see. So through this the sperms and the ova are provided, that is the ovum that is given to the fallopian tube. So ova and sperm mixture is there, and what happens, they will undergo fertilization and further development will be there. So here the female is not able to produce gametes, so here you can say the ovary might be non-functional. So the non-functional ovary will not be able to produce gametes, that's why you have to supply gametes from the outside or donor female. Now come to intracytoplasmic sperm injection, that is shortly called as ICSI. So here what happens, you can see the egg is there, the egg cytoplasm is there. So the egg, that is, this is the egg, this is the internal part is the cytoplasm. So this is holded by a holding tool, you can see this is the holding tool. So this holding tool is helping in holding the egg properly, and through an injection needle a sperm is that is injected into the ovum or into the egg cytoplasm. So sperm is injected into the cytoplasm using a fine needle. The needle should be very much fine, it should be thin, and it should carry the sperm, and the sperm is directly injected. This is the difference here, the sperm is directly injected into the ovum to form an embryo in the laboratory, and the embryo transfer is carried out. So this is taking place in the laboratory, and here what happens, the sperm is directly injected with the help of a fine needle. So you have to remember intracytoplasmic sperm injection, where the sperm is that is injected through a fine needle in the laboratory, and the embryo transfer is carried out after the fusion. Now come to artificial insemination. So as the name suggests, artificial means this process is quite different from natural. So here what happens, the semen is collected from a husband or healthy donor. So the husband and healthy donor will donate the sperm, and this is artificially introduced with the help of needles, you can see. So here you can see the test tube is containing the sperms, and so they are introduced in the help of a with the help of a needle, or you can say injections, into the that is the vagina or the uterus of the female. So here this is called as intrauterine insemination. So artificial insemination, that is it can be into the vagina or it can be into the uterus. So intrauterine insemination is the term when it is used, that is the sperm donor into the uterus. So where this is used, so what is the application? This is useful where there is inability of male partner to inseminate, or due to low sperm count of the ejaculate. So whenever the male partner is not able to produce enough sperm, or there are low sperm count in the ejaculate, there artificial insemination can be used. Now one pertinent question arises, is ART are the only solution to infertility? The answer is no, definitely no, because what happens, the infertile couple, the need is to have child. So it doesn't, that is it should not matter that from where you are procuring, that is from where you are getting the child. So if you are not able to go for ART, or even if you are able to go for ART, that is assisted reproductive technology, these are very modern technology and they require huge amount of money. So at last the aim is to have children. So the infertile couple can adopt the orphans also. Here you can see the orphans, they are getting no food, the lack of food, lack of shelter is there, lack of education is there, lack of cloth is there. So the orphan can be adopted, and in our country or in all over the world there are many millions of orphans, they are struggling to get their daily livelihood. So they can be adopted by the infertile parents, and what happens, this will help both, that is it will save also money of the parents, and it will also be helpful for the orphans. And as we live in a society, so it's our moral duty to support all, and if you are able to help someone, then definitely you are making this world a better place for others to live also. So if that is ART should be less used, or you can say should not be used, and the infertile couple should be encouraged to adopt the orphan children, or the children that is they are not having any person to take care of these children. Now amniocentesis. So amniocentesis is a prenatal diagnostic technique. So prenatal means before birth, and this diagnose the, how they are diagnosing the chromosomal abnormality with the help of amniotic fluid. So a sample of the amniotic fluid, so the amnion is there inside the placenta, so that is the inside the fetus in the uterus, in the womb. So the amniotic fluid from the womb of pregnant woman can be taken in the early stages of the fetal development, and this early, that is these cells can be cultured and analyzed. So the analysis and that is after culturing, analysis is done, and this analysis is helpful for the determining the chromosomal abnormality. That is, with the help of karyotyping, the chromosomal abnormality can be done. And this was set up to, that is the for the medical termination of pregnancy, that is the abortion of the child when there are some abnormality, or the that is the pregnancy can be harmful for the mother or child or both. But nowadays this is misused for the determining the sex of the fetus, and this is very harmful, because the people are going for female feticide if they are knowing that a female fetus is developing. So for a healthy society, the ratio of male and female should be made, that is should be equal, that is the number of male should be equal to number of female. And if the sex ratio is not maintained properly, this will lead to very serious consequences in our society. So the amniocentesis should not be used for the female feticide or for determining the sex of the children. This should be only used for the determining the chromosomal abnormality or any developmental, that is disorder occurring in the child. So the female feticide should be discouraged at every cost. Thank you. This is the end of the video. Thank you for watching, and if you are new to this channel, please subscribe the channel and press the bell icon for getting more updates. Thank you.